welcome to today's edition of Hope and Help for Families. I'm Reverend Matthew J. Watts, your host, and we are delighted that you've allowed us to come into your home today with our program. We're really excited about today's program. We have two dynamic ladies from Beckley, Miss Joyce Seabrook and Miss Barbara Charles, and they are the co-administrators for the Antonio Avenue Community Clinic. Ladies, welcome to the program.
Thank you. Thank you so much for having us here.
I'm excited about this topic,
Yes.
the healthcare in the African American and minority community. Before we delve into the topic, I would like for each of you ladies to give a little bit of a background of yourself in terms of how you ended up in Beckley, West Virginia, to start on this exciting project. Ms. Seabrook, why don't you go first?
Well, it's really a long story. And moving to West Virginia, the intentions was not to work. My intentions was to come and write another book. I have written one book, and my intention was to come here and write a book and raise a child. But after arriving here in West Virginia and in Beckley, I believe the Lord just directed me here, because everything that has happened has been a ministry, so to speak. First opening up Prime of Life Adult Daycare Center and dealing with those issues with people that had dementia. Mm-hmm. And then we had the opportunity from starting and working in that business. A New Beginning personal care home came available. So we took over the running of that facility that had 22 residents that were in need of a lot of care. And after taking it over and complying, coming into compliance with state regulations and not only for the building, but for the residents, we then saw a need to where there was a medical need in our community. We had children that weren't going to the doctors for the shots, to go to school. The parents weren't going for the regular checkups because of transportation, for a number of reasons. So we decided that if we would open a clinic, not only for our residents, for their care, but for also that area. So this is how Antonio Avenue came into being.
Excellent. Now, you are a native of West Virginia.
I was born in West Virginia. My parents went to school in Beckley, but we moved. We migrated to Cleveland, and from Cleveland to California. And spent over 35 years in California.
So like a home in Pigeon, you made your way back home to West Virginia.
Came right on back.
And we're delighted.
Mm-hmm.
Now, Ms. Charles, you ladies are friends, and you are not originally from West Virginia.
No, I'm not.
But you've made your way here. Give us a little bit on your background as to how you got to West Virginia.
Well, basically, I came here from California when Ms. Seabrooks made a telephone call to inform me that I need help. And I came here to assist her and not to actually stay in West Virginia, because you have snow here. And I'm from sunny Southern California, and I didn't believe in snow, so I came for a minute to see what was available here, help her, and go home. And came here and found such a need that I could work with her and assist her in some of the things that we were doing, and working in the same field, in the same area, and enjoying the beauty and the home atmosphere of West Virginia. But to find out there was such a lack and such a need in the particular areas for the African American community. See, I've been around a long time. I'm an old civil rights person. I marched and walked with Dr. King. And so I came out of an era when we see a need that we stand up and we take this and we talk about it. But I had no idea that there would be such resistance to, what we were presenting to the state and to the other individuals in the area of healthcare and other areas that we're trying to get information out to.
Let's talk about that, because you ladies recognize the need, a very well documented and chronicled need. The West Virginia Health Department actually issued a minority health chart book which showed the disparity in terms of health care between blacks and the rest of the state. Some of the statistics that blacks are dying from diabetes at a rate twice that
Yes.
of whites. Prostate cancer, again, death rate twice that of whites, and
Yes.
then there's some other pretty serious issues. But the thing that really attracted my attention, that you decided to do something about it, not just talk about it, not just agonize over the situation, but to actually step out and to establish a health clinic in a densely populated minority community in Beckley on Antonio Avenue. Tell us a little bit about how you actually were able to secure a building and then establish a clinic in the heart of a low-income community with a high African-American population.
Well, adjacent to the personal care home was a vacant building that was initially used about 13, 14 years ago as a deacon's home. And it had been sitting for so long, and the owner of both properties wanted us to take over the building. So we decided, with that need of a
These are
clinic.
abandoned properties.
Right, abandoned
sitting idle
properties,
in the
just sitting
community.
there, just sitting in the community. No one is doing anything with it. The limb, the trees and the roots and from the next house was all over the building. We had to get all that cut. We had to renovate, and we used our own monies. We talked to several other facilities that did help us with the exam tables, donating exam tables, and we did get some supplies.
And that was through
we
the
did-
Appalachian
That
Hospital.
was through, right.
Appalachian Regional Hospital?
Yes.
Appalachian Hospital, who really helped us in getting certain supplies. And we also want to mention that we have a lab available within
Yes.
that clinic. And they did donate many of the supplies, and we want to give credit to Appalachian for coming and helping us in that. And there were other donations that came in through other individual programs that we were able to get.
Now, when did you start, when did you physically start the renovation to the building? From the time you started, how long did it take you to get the building renovated and get the clinic opened for clients?
It was about 9 months before we actually opened. January 28th, 2002, we physically opened the doors. But we had been working about 9 to 10 months prior to that on renovation and securing doctors and trying to get the other things that we needed.
What's been the response from the community? How have they responded to this initiative of bringing health care into the heart of the community?
We've had an excellent response. We've serviced, since January, we've serviced about 250 patients.
That's tremendous.
And
And I understand you've also gotten support from some of the local ministers who serve in an advisory or some capacity with your organization. Is that correct?
Exactly.
Yes.
And what we have encouraged is for the leadership of our community to be the one to make the response, because here again, this is a faith-based initiative, totally put together by faith and belief that the need is here, and what we can do is make it a reality, which we did, and now we have to keep it going. So as with everything else, when you're coming from this level, as you talked about, this is grassroots. This is a totally grassroots issue. And so we've made this available. And now we say, where do we go from here when we have put the initiative together? This is what is being looked at, for in this state, across the country. The need is definitely documented everywhere that we need health care for accessibility so that individuals can come to a clinic right within their area. And because we have patients that are traveling 60 miles, especially AIDS, HIV patients that are coming up out of the area, over 100 patients traveling to Charleston area to get medical care. They have health issues of problems that causes them to become ill and sick with this type of right. And you got a clinic that it literally is right within walking distance of many of these individuals, and we're paying transportation out and all these other things coming from state funds when they could be serviced right there.
So there's a real opportunity to serve people right there in East Beckley and the surrounding areas.
And
with this
save the
clinic.
state money.
And save the state
Yes.
a
State
significant amount
money.
of dollars.
Yes, many dollars. That those transportation dollars can be put right into there. and be utilized to help in what we can do. Plus, they can get their lab work, and we're looking for a pharmacy where we can bring that, into fruition for these individuals who may not be able to get out to get their medicine. There are so many innovative things that can come out of this other than just the healthcare issue.
Mm-hmm. Let's talk a little bit about East Beckley and about Antonio Avenue. A lot of our viewers are from the Charleston community, and so we have a pretty effective public transportation system here with the KRIT bus system and that type of thing. But Beckley doesn't have as much public transportation, and so some people may not realize what a barrier it is to access health care if you don't have transportation. Describe the community where the Antonio Avenue Clinic is located.
It's located in it's East Beckley, and it's a blighted area, and there's no public transportation for the whole of Beckley. Now, we do have the Commission on Agents that, you call them up and they will come and pick you up and take you wherever you want to go. We have houses in that area that have been deserted. We have houses that are falling down. We have a community that's really dying. The community is full of senior citizens, young people, drugs. We have drugs, a lot of drugs in the area. We have a lot of forces that we're fighting against, but because there's hope. There's a lot of hope in that area, and we want the clinic and the personal care home to be a beacon, to be a start. We have the university in the same area. The area is very nice. There's a big difference. Our teenagers, our young adults are leaving the state because there are no jobs available. We do hire. We have what, 13 employees?
13 employees.
13 employees total for both facilities.
Well, it's 16 with the center. It's 13 with the personal care home. So we're also looking at jobs.
Jobs for the community.
So with the personal care home, with the clinic, we're talking about that you're providing 16 jobs in the community.
Right, in the community. And it's so many other things that we could set up in the community. We have the resource, we have the bodies, and all we need, we can set up training programs. There's so many things that we could do at the clinic and at the personal care home to provide these type of resources for the community.
We're constantly talking about welfare as being one of the issues as well. All of the isms, if you will, that we talk about, which is welfare and training and employment. We're spending millions and millions of dollars to get these available. Well, being that we're a personal care home and we're looking at nursing, LPNs, we're looking at all of these RNs and other things that can occur, lab technicians. We could train in all of these areas. And I'm very familiar with OJT, on the job training, and all of the other acts and enactments that have come down for the years. We can provide that in this area, which has one of the highest unemployment areas. So we're not just dealing with health care, but we're dealing with employment, we're dealing with welfare issues, we're dealing with training. And so we have an answer for these. So why is it that we cannot reach to the individuals? And we've been in contact with many, many agencies, not just here locally, but all the way to Washington. We have no opposition to say, we're here, we're visible, we're available. So where are you? Where's the powers that need to be to help us in what we're doing?
And so if I'm hearing what you're saying, and I think that I am, is that the primary care home and the health clinic are not merely venues to provide that service, but it's also serving as an economic development impetus because it's creating employment opportunities for people in the community. It also can serve as a job training venue because we know that there are many employment opportunities in the healthcare area. And so right there in the heart of East Beckley, one of the blighted communities in Raleigh County, you can be this beacon of hope, doing job training, economic development, providing health care, and so forth. And not only will that community benefit, but Raleigh County in large will benefit, and a workforce that's been trained to fill jobs outside of the East Beckley community.
Exactly. That's exactly what we're saying. Everything that you just put together is our packet that
Let's
we're
take
offering.
a brief break, and we're going to come back and we're going to talk more about what people can do to help the Antonio Community Clinic there in Beckley, and how they can provide you with support and come alongside you to help you make this vision become even more of a reality. If you just tune in, you're looking at Hope and Help for Families. I'm Reverend Matthew Watts, your host, here with Ms. Joyce Seabrook and Ms. Barbara Charles, talking about health issues in the African American community. We'll be back in just a moment.
Following the tragic events of September 11th, there have been hundreds of violent attacks against innocent Americans.
Remember what that flag you're waving stands for.
Remember, please stop the hate.
We're stronger when we are united.
Remember
what that flag you're waving stands for. One nation,
Under God.
Indivisible.
with liberty.
And justice.
For all.
in America, there's either room for everyone or it's not America.
Don't pick the wrong fight.
Let's keep America land of the free.
Stop the hate.
You just tuned in. You're viewing Hope and Help for Families. My name is Reverend Matthew J. Watts. I'm your host. I'm here today in the studio with two dynamic ladies, Ms. Joyce Seabrook and Ms. Barbara Charles, and they are the co-administrators of the Antonio Community Clinic in Beckley, and that's in Raleigh County, just near my home in Mount Hope. And we're excited about what these two ladies are doing, their vision and their passion to bring not only health care and primary care for seniors to Raleigh County, but also economic development and job training. When we took the break, Ms. Charles, we were talking about the fact that you ladies have faced some challenges. You've worked extremely hard to renovate this dilapidated house, to turn it into a clinic, to be a beacon of hope in the East Beckley community. You've expended a lot of your own resources, and you are a 501c3 tax-exempt organization, but you're still facing some challenges in terms of securing the resources you need to make this clinic really a vibrant force that it can be. Talk to us a little bit about ways that people might be able to help, from the person, the individual, to churches, to business, to anyone that's concerned about health care in Raleigh County and in West Virginia in general.
One of the major things that we're doing is we're asking, especially within the faith-based community, pastors, starting with our leadership, because they are ones reaching out within our community and other communities, that they support us through donations. We need donations of monies in order to pay for our doctors, in order to many individuals come in our clinic don't have money to even pay for themselves. That causes us a problem because we don't have the indigent funds yet available to us to pay for those who can't pay. We're seeking that right now, but they could be a great part of this resurrection that we're having within our rural community by providing us with monies to come in to support us, and individuals who are out there who feel that they see this as a need and an area, they can also do the same thing.
And any individual that make a contribution, it is tax deductible.
Yes.
Because you're a 501c3
Exactly.
entity.
Yes.
And as well as businesses could make contributions to your
Yes,
efforts.
exactly. And we're reaching out in all of those areas. It is vitally important that West Virginia wake up. There's a wake-up call right now. We in this country, we've sort of relaxed a lot on many of the issues that confront us. And here again, I go back to the days when the African American community cried out in the 60s for certain individual needs that it had. And it seems as if we don't watch out, we're going to slip right back into the same economic disadvantage things that we had at that time. And that was the purpose of these entitlement programs. And I was around to see those entitlement enacted upon, which we still have available today. But we've got to bring the resources here in West Virginia so that we can start moving and catching up in a lot of ways to the rest of the country, the rest of the nation. Many issues are already across the country that have not impacted here. So we're going to have to bring that here to West Virginia. We're a little bit behind, and we're going to have to catch up, and we're going to have to do that, and by talking to our legislators and talking to our state representative, talking to our pastors and community leaders, that this is what's needed and this is what we're going to have to do.
And what you're doing, Ms. Seabrook, with the Antonio Avenue Community Clinic, it really could serve as a model, could it not merely for minority communities, but for other rural communities where they don't have access to safe and affordable health care, what you're doing actually could serve as a model for any community and anywhere in West Virginia.
Absolutely, you're correct.
Let's talk a little bit more about that, about the fact that if you guys are able to secure the type of funding that you need to really flesh out this model, how could this actually be implemented in other communities? How could you maybe move to another community, maybe possibly McDowell County or Mercer County, some other counties where there is a need that's similar to what there is in Beckley?
So totally duplicate the similar things, except in the beginning, start with the fundings, not much as we did, you know, it's coming out here and doing our own thing, but starting first with the initiative to make sure that monies are available and that the doctors are secured and that they are going to be paid. Our doctors have been wonderful. They've stayed there with us, and you know, we need monies to provide to them. But what we want to see happen is grants that are made available in opening the clinic and getting it started up and running to make sure they don't run into a crisis situation such as we have. But they could duplicate our entire model. We're a model, and they could come in and they could see what has occurred there, and then they could go to these other counties and then be a beacon in their area for the same thing. And from there, then they could shoot off to maybe possibly a CDC and some other areas for economic development and begin to look into other areas for stores and other things that could be made available. So this is a start.
Mm-hmm. If someone watching this program is interested in finding out more about the Antonio Community Clinic, where would they call or where would they write if they want to make a contribution? What address should they send that contribution to?
You could write to 120 Antonio Avenue. Our mailing address is Post Office Box 2212, and that's Beckley, West Virginia, 25802.
And what's the telephone number?
Telephone number is area code 304-254-8576.
Exactly.
And we'll get that again before we end the program. Let's kind of turn the corner just a bit. You ladies are also publishers.
Yes.
I know, Ms. Seabrook, you are actually an author, and we will talk a little about your book before we end. But you also put together a community paper that you issue, what, quarterly or monthly?
Excuse me, it's a quarterly paper.
Quarterly paper, the
Yes, it
Community
is.
Voice?
Yes, it is. And this is 2 years old. We started this under the NAACP in Raleigh County. And I edit this paper, and Joyce Seabrook co-edits with me on this here. Here again, communication is our key, just as such as this programming you have here. We cannot do anything unless we start communicating. And we don't have a lot of access to communication. Here again, we saw a need that we must be able to get the information out to the community about what's going on. So we print this paper. There are 5,000 of this tabloid, and we're circulating it throughout the state through the offices of the NAACP, which is the National Association of Advancement of Colored People in West Virginia, who as of August 8th, 9th, and 10th, by the way, are having their convention in Beckley, West Virginia.
And so that Beckley is hosting the NAACP, the West Virginia NAACP convention, and I understand that you're also the chairperson.
Yes, I am.
What type of activities is planned for the upcoming NAACP meeting on August the 8th, 9th, and 10th?
Matter of fact, many of the things that you have listed and outlined in your Hope Community Development Corporation are the very issues that we're going to be dealing with: education, health, imprisonment among teenagers, the high rates of all of these statistics that confront the state of West Virginia are the very issues that we are going to be talking about in this time, this critical time. America is at war. There's no more critical time than we could be talking about than right now. But we're also at war on our streets, in our areas. And Beckley has been very well in that it has maintained without having a lot of the ills that other cities have had. But it's on its way if we don't do something to do preventive medicines for these particular things that have afflicted other cities.
Right. And that's one of the things that we have tried to articulate over the years, that a problem in one community is not a problem that is exclusive to that community.
Exactly.
And so issues that are affecting the African American community, whether it's a poor educational system for the youth in the African American community in the schools, whether it's overrepresentation in the juvenile justice system, overrepresentation in the criminal justice system, healthcare issues, these are issues of the community and of the state. And so there is a price that we all pay
Exactly.
for failing to adequately fund intervention and preventative type of programs. And so one of the things that's sometimes a little bit frustrating to me is it's like we're willing to pay on the back end
Yes.
more than what it would cost on the front end to address the problem. And so if I understand what's going to take place at the NAACP meeting on August 8th, 9th, and 10th, you're going to be talking about strategies, things that we need to be doing as community people, as community residents, but also challenging the broader community in terms of how they should participate and support and help to bring resources to bear so that we can develop the right strategies to address the issues in our community.
We have many individuals that are going to be coming from our national office around the country. The Reverend Cecil Hope, who is the Religious Affairs Director for the NAACP, will be addressing Pastor's Prayer Breakfast, which is going to be one of the highlights of this convention. And we're going to need pastors. Pastors need to come out and understand that we have a crisis. This year, Kwasi Manfumi has stated that our theme is freedom under fire. We're under fire in this country. We're losing what we've gained, and we need to come together. And so we are expressing a definite need that pastors and community leaders need to be at this prayer breakfast with us and stand with us in this convention. This is very important for the state of West Virginia.
And so when people come to Beckley August 8th, 9th, and 10th for the NAACP convention, which is going to be at the Country Inns and Suites, it's right there on Harper Road,
Yes,
correct?
it is.
Right as you get off of the turnpike there in Beckley on Harper Road. At that time, they also could find out more about your work. They could find out more about the Antonio Avenue Community Clinic and about the personal care home, and they could find out more about how they might be able to partner with you and support your efforts so that you can expand this model that can be replicated in other parts of the state. Is that correct?
Yes.
Okay. In the last few moments that we have, Ms. Seabrook, if you might just talk to us a bit about, right now there are some pressing issues that you have that will, your ability to address some pressing issues is going to determine the future of the Antonio Community Clinic. Speak to us about what those issues are and how people might be able to help immediately to help this endeavor be successful.
Well, number one, the clinic will need bodies. We need people to support us by coming to the clinic. We need people that will donate to us, help us and with finances. We need unity in business is progress. Mm-hmm. And in order for a community to survive, it takes the whole community to work together. Okay. We need to, when we see our communities going down, which is happening over in that particular area, mm-hmm. we need to educate our community on things that they can do in keeping and building up their communities. We need to, I can't stress enough that unity, we need to have unity among us.
Well, excellent. Ms. Joyce Seabrook, Ms. Barbara Charles, thanks for coming and be with us.
Thank you
and
for
wish you much
us.
success with the Antonio Avenue Community Clinic. God bless you. Thanks again for tuning in to Hopeful, Helpful Families with Reverend Matthew J. Watson. We'll see you next time.